I'm so thrilled to be part of this dazzling audience and community of global citizens. The conversation that we're about to have could not be more timely, both globally and here in the United States. Because as we know, the fight over medication abortion continues and is likely to head back to the Supreme Court. This map that you're about to see shows the current state of abortion access in America, from most available in blue to most restricted in red. And so, Dr. Palacio, let's just kick it off. You're with Guttmacher. You helped make this map. You are the leading research institution focused on sexual and reproductive health. Give us the state of play in this landscape that we're seeing over you.
Well, thanks so much, and it's a really important conversation. And the state of play, frankly, is very disheartening. Since the Dobbs decision, the fall of Roe v. Wade, we've seen a slew of very aggressive actions to restrict abortion. You see there in the purple these huge blocks. We've got 13 states where abortion is essentially banned. Over half of the United States, over half of the states, have very significant restrictions on abortion. We update this information in real time. You can actually, if you go to our website at guttmacher.org, you can toggle in a state and you can see specifically the restrictions that are happening. And you talked about medication abortion. And you know, in 2020, it was clear that over 50% of people were getting abortion via medication abortion, despite the fact that the Supreme Court said, well, we're sending the law back to state by state. What's happening now, this case in Texas, one judge in Amarillo, Texas.
One extremist judge.
One extremist judge, and they shopped for this judge, basically is using an obsolete law to say that the FDA did not have the authority to approve one of the main two drugs used in a medication abortion, mifepristone. This drug was approved 23 years ago. So we've got over 2 decades of safety and efficacy data on this medication. One judge said, nope, do-over. And it is clear if that ruling holds, that medication abortion, as we know it, with a 2-drug regimen, it's not just state by state, it's across the entire United States that this drug will become unavailable. And it's, so it's a very significant situation.
That's what we were talking about backstage, that it's not state by state. It will affect the entire country, that one ruling. Busy, you have been very busy, taping shows and telling stories out there, but you've also squeezed in a lot of activism. You were protesting on the night that Roe v. Wade was overturned. You tell stories in an effort to, in your mind, fight the shame and the stigma around reproductive rights.
Right. Well, I think that part of how we got here is that I think my generation especially took Roe for granted and thought that I was told by my mother, Roe is, we did it. Like, it's done.
Settled law.
It's settled law. It will never be overturned. And, you know, I think that the attempts to really shame and silence women who've had abortions, have needed to get D&Cs or have abortion care for whatever reason. I had an unintended pregnancy when I was 15 years old. My home state of Arizona would now make it incredibly difficult for me to get the same compassionate and easily accessed abortion care that I received in the 90s. I realized several years ago that what was happening and these laws, the trap laws that had been passed, and these anti-abortion extremist politicians that do not reflect what the majority of Americans and people around the world believe to be true, which is that bodily autonomy is necessary for equality. And abortion should not only be legal, it should be safe, and it should be easily accessible for everyone, not just white girls from Scottsdale, Arizona. So I realized that part of the reason that we were in this position is because people weren't talking about these issues.
And you have been talking. We saw video of you testifying in front of Congress. This is an incredibly important issue here, but let's widen the lens and look globally, right? Liya, we're talking about 200 million women in low and middle income countries not having access to reproductive rights in many ways. STDs are not being addressed in many circumstances. Tell us about Girls Effect and the role that you're playing in Ethiopia.
Great. So yeah, our work is very much centered on girls, adolescent girls and young women. And it's very much about, listening to them, making sure that these problems are highlighted. And it's what you just said. We look at the developed countries and what's happening there. And then when you look globally, especially with the low-income and middle-income countries, it's much worse. The conversations aren't even at the level of abortion. They're at the level of access to vaccination for HPV and cervical cancer, still being, in Ethiopia, the second most deadliest cancer of women. That's where we're at, and it's a few steps behind, and all of that exacerbated by the fact that in the society, the conversations aren't happening. People, the social norm doesn't allow for young people to have conversation about sex. It's not a thing that happens.
Dr. Palacio.
Yes, and I just wanted to add, your experience, and we do research globally as well. And it's very clear. We've done research where we have abortion rates across the entire world. And when our data internationally show that when you restrict abortion, you don't actually decrease the abortions that are sought or had, because this is a normal part of reproductive life. All you do is render them unsafe. And you render them unsafe for the most vulnerable.
Liya, both you and Busy use popular culture to illustrate these stories. You have this popular drama series, Yenya, right? It's become a national sensation. Tell us about some of the storylines. I know that you talked about the HPV vaccine and how it prevents cervical cancer. How effective do you think these storytelling devices are to fighting those misconceptions?
Me and Busy were just talking behind the stage about how important that is in terms of telling that story, that visibility, and young people telling their own stories. In countries like mine, 70% of the population is under the age of 30 years old. That's true for most developing countries. And when you don't have anything that represents them, talks to them in the way that they want to be spoken to, and creates a conversation, just a platform for a two-way conversation, not telling them what it is and how it should be, but actually speaking to them and making sure that they tell their own stories, that becomes really important. So we try to tell stories with, emotive storylines. For example, a grandmother who has a grandchild and she's an orphan, and the grandmother passes away from cervical cancer. And it's a beloved, funny character, and everyone kind of gets attached to the grandmother. Now everyone knows about cervical cancer and about HPV vaccination. The granddaughter becomes an advocate for HPV vaccination in the storylines. And we see that, people are now more likely, 2 times more likely to understand about HPV vaccination. People who watch the show are 2 times more likely. They are 30% more likely to have conversations about cervical cancer. And this is compared to people that weren't exposed. So that exposure and that visibility becomes forefront, and it becomes the most important part.
I think that looking at the kinds of media that people consume is really important. And I think that, especially in the United States, where so much of our content, narrative content progressive narrative content has gone behind paywalls, you're leaving out a wide swath of Americans who are not able to watch Veep and see Julia Louis-Dreyfus say, if men could get an abortion, they'd get them at an ATM. I just feel like we could do a better job in my industry, in entertainment, by taking a cue from what you're doing in Ethiopia and really incorporating more of these progressive ideas and storylines. And they're not even that progressive, guys. It's just healthcare. It's just destigmatizing women's bodies, people who bleed, and people who need abortions.
Right. It isn't progressive. As you know, these polls show that 70% of people support some form of reproductive rights, abortion rights, et cetera. But Dr. Palacio, I want to pick up on the HPV vaccine and its relationship to cervical cancer. A woman dies every 2 minutes from cervical cancer. We were talking backstage about the rise in throat cancers related to HPV.
Absolutely, and the work that you're doing is so important because there isn't a one-size-fits-all to get the information, right? We rely on the evidence, but the evidence is really just one way of representing the stories of real people. And vaccine and investments in vaccine is so important. And it's not just investments in HPV vaccine, which reduce cervical cancer by enormous amounts, but it's investments in contraception. It's investments in maternity care. These investments really matter. They save money, they save lives. Every dollar invested in good reproductive care in Kenya will save $2.71, for example, in unsafe abortions and maternity care. But it also saves lives. If you invest in good contraceptive care and you provide the needed funds for this, you get 2/3 reductions in unintended pregnancy, 2/3 reductions in maternal mortality, and in unsafe abortions in low and middle income country.
Also, isn't it better for the economy?
It is also
Let's just
better.
talk about the money, because that's what people care about, right? Because they clearly don't care about women in this country. But it's better for the economy when people have bodily autonomy.
You save money, it's better for the economy because people can live the full lives, and it saves healthcare costs.
It's a key to economic development,
Yes,
for sure.
correct.
But Busy, Dr. Palacio is talking about tools that are often employed by the UNFPA, the UN Family Planning Agency, as you know. And what kinds of tools should we be looking at, and what needs to be done, frankly, to help support UNFPA?
Well, UNFPA is looking to the countries that can donate. They need about $100 million, which is actually, I'm being told not that much money. To me, I don't know, but the UNFPA provides so many incredible services. The United States and Germany and Canada need to step up and fund the program, but also the private sector leaders could step in and help. This is preventing unintended pregnancies, providing safe abortions, maternal mortality rates, all of these things that have such a huge impact globally and are things that are real issues here in the United States as well.
I've seen UNFPA agencies and organizations on the ground in both Mozambique and in Tanzania, and it really is for infant mortality, infant maternal care, helping going out into the villages for basic health care needs.
I think that being reductive about what healthcare is has not serviced anyone. And the radical right in this country has done a great job at being incredibly reductive about abortion. But this is so much bigger than one healthcare service.
And equal access isn't just about providing vaccines either. There's a whole other side to it, which is about making sure that demand is there and we're building resilience. Because what I hate to see is when there's limited services available and even that what's available is not accessed by adolescent girls because they are not even aware of it. It's not, it's not accessible to them. And so if you still have all those barriers and you provide all the vaccines in the world, it becomes really important for a combined type of effort, like the work that we're doing with Gavi on making sure that we hit not just providing the vaccinations all over the world and we have equity, but also making sure that girls can access them. They're aware of them. They know why they're getting them. Even when, the problem is way down the line, they understand what it's for and myths are addressed.
Dr. Palacio, your organization measures the impact of these programs. Give us a sense of what you see.
Absolutely. You can actually see the difference that the dollars make. We now have an impact calculator, or family planning impact calculator, where policymakers, advocacy groups, folks can go in and look at their regions and sometimes below the regions and say, for every dollar investment in this region, what kind of savings am I going to get? So we can provide you with the tools that you need to do the advocacy. We can provide policymakers, some of whom are actually trying to do the right thing with the air cover that they need with the information. But you are so right that these things are interrelated. And certainly here in the United States, the anti-abortion movements, the anti-LGBTQ movements, the anti-democracy movements, those are not separate movements. They are very much intertwined. They are very much well-funded, and frankly, they're being exported to other countries with dollars and strategy. And unless we sort of all get together and understand how well-funded and intentional these oppressive movements are, we're not going to be able to unpack them and protect people.
I cannot believe we're out of time, but thank you, Dr. Palacio, for all of your insights. Thank you, Liya, for the work that you do, and for Busy for being you. Fantastic. And for all the global citizens out there, clearly this is a call to action, and we appreciate you joining us for this conversation.